Hello and hi. Today I want to present about my Persuasive speech. My name is Muhammad NuriemaN bin Daharuddin, and my lecturer's name is Dr. Haida Umiera Hashim. Um, my title is Walking Frequently Can Improve Both Your Mental and Physical Health. General purpose to persuade, specific purpose to persuade the audience to start walking to improve their health. The central idea, regular walking can improve your mental and physical health. Let's get started. This is my list of my content presentation, which is a title, introduction, body, and a conclusion. Introduction. Life has become all about convenience and ease lately. We have dishwashers, do we? So we don't have to wash dishes by hand with electric scooters, so we don't have to pedal while riding. I mean, isn't it ridiculous? Yeah, today luxuries have been welcomed by the masses. They have also been accused of turning us into passive. They target slots as a reform slot. I know how easy it can be to be slipped into the convenience of things and not want to move off the couch. I want to pursue you to start working. First of all, Malaysian leads a passive lifestyle at the expense of their own health. Adults watch between 15 and 18 hours of a TV a week. This means that we spend approximately 40% of our leisure time in front of the TV. Ironically, it is also reported that Malaysians don't like many of the shows that they watch. Furthermore, in a recent survey of 200,000 people in over 40 countries by Stanford University on physical activities, Malaysians walk an average of 3,900 steps a day. You may think it's already a great effort, but our neighboring like a Singaporeans take 5,600, Thais 4,700, and Indonesian 3,500 steps per day. Here are some walking tips that I want to share to you guys. Establish a routine, make walking part of the daily must-do activities. Be it 15 to 30 minutes at a minimum, the with own tempo and rhythm walk. Start a moderation either alone with a partner or in a group. Once you're getting a hand of it, increase the time and distance. For variety, try climbing up sets of slopes. Slowly but surely, it will build up stamina. Walking after a meal improves digestion and helps with better sleep. It's a good habit to invest on. The second one is a venture out. Sometimes walking the same route can be boring. Why not try new routes or take a detour? A different environment requires us to do some exploration. We can do this by parking our vehicle further away or taking public transport, looking around and try out new things. Get challenged like young minds always like to. New learning boosts neuroplasticity. Put away the handphone. Multitasking can take a rest when walking. Be on the lookout for what is in front and the surroundings that save us from getting involved in accidents. Walking deserves our mindfulness. Also, we can maintain a better posture for the neck with reduced straining looking down our devices. It helps to prevent unnecessary visits to the doctor and painkiller ingestion. Another one, keep cooling. Walking under the hot sun can be draining during off or after. To walk drink plenty of water. Plain water is good enough. It prevents muscle cramps and helps the body to revitalize. Choose a suitable time for a walk, such as the early morning or late evening when it's more cooler. Walk in the park of parks where trees and shades are aplenty. W- What I mean, put one seats, but are not exercise and open air within the reach of us all. Indeed, walking is a free, empowering, and democratic. Everyone can do it. The onus is on the government, town planners, landscapers, and architects to make our cities and building walkable and safe. How do we harness the benefit of technology and not be colored by it? Furthermore, dietary practices, food purchasing, and perception about healthy food availability and affordability, a cross-sectional study of low-income Malaysian adults. Malaysia has the highest rate of overweight and obesity among Asian countries. Obesity is increasing particularly among low-income population. This study aimed to assess dietary practices among low-income adults in urban communities, including gender and ethnic variation to inform the development of locally tailored evidence-based intervention for health promotion. This cross-sectional study was conducted from August to December 2020. Stratified sampling was employed to recruit 2,983 low-income adults from households in the bottom 40% of the economic spectrum B46 public low-cost housing flats in the Federal Territory of Kuala Lumpur, Malaysia. Face-to-face interviews were conducted using a structured questionnaire to understand dietary practices, perception of healthy food availability and affordability, and factors affecting food purchasing decisions. Adults in low-cost housing communities have unhealthy dietary patterns with low intake of fruits and vegetables and high intake of ultra-processed food and a calorie-dense local foods. With a variation across gender and ethnicity, the study highlighted the need of educating low-income families on diet disease, relationship, and possibilities for inexpensive, healthy eating that rely on minimally processed fresh food. Policymakers engaging the food industry are advised to consider how increase the affordability and availability of healthy foods in low-income communities in urban areas. Our visualization. Now you can see and watch the picture in my presentation slides above. Now close your eyes and imagine a future where we prioritize and embrace healthy lifestyle in Malaysia. The picture says a society where they are doing daily exercise as their routine and individual are practice their healthy lifestyle and processed food and that provide the essential building blocks for optional health. Exercise is important to maintain a physical fitness and overall health and wellness. So why don't Malaysians do it? In the 2019 National Health and Mobility Survey, 50.1% of the country adult population were reported to be overweight or obese. Similarly, the United Kingdom Medical Journal, the lenses pointed to Malaysia as being the most obese country in Southeast Asia. But despite the staggering figures, why are some Malaysians still reluctant to exercise? But despite the staggering figures, why are some Malaysians still uh, reluctant to exercise. Life coach Suraya Kulub said Malaysians are reluctant to exercise due to their busy lifestyle, especially as the nation is towards a post-COVID-19 recovery phase. Our habits are interrelated with our mindset. When we were in lockdown, we started to exercise to motivate ourselves and occupy our time, she told the Sun. She said would take as much as 21 days of daily workout to get into the habit of exercising. A simple exercise can mean a 20 minutes of brisk walk 3 to 4 times a week. Hormones such as endorphins, which are produced in our brain, are released when we move, and this can improve our mood, which is good for our overall health. Suraya said another reason behind the reluctance to exercise is that it's not seen as enjoyable. Phys- So the conclusion, the action is in closing, I argue you to start walking more. Walking is a easy activity. Park away from stores and walk instead of driving to the nearest convenience store. Take 20 minutes and enjoy a walk around your neighborhood. Hide the TV remote, move off the couch and walk. Do it for your heart. Thank you for listening. Thank you.